Hey everyone, and welcome. I am absolutely thrilled to have you here today. In this analysis, we're going to do something really important. We are going straight to the medical science to unpack the 2022 Obesity Guideline, published by the Clinical Endocrinology and Diabetes Association, also known as KEDD. Now, if you've ever felt completely overwhelmed by all the conflicting advice out there on weight loss, or maybe you've blamed yourself or even others for struggling with weight, you are in the exact right place. We're going to strip away the internet fads, the myths, and especially the guilt. Instead, we're looking strictly at what the actual clinical data and the top endocrinologists are telling us. Here is our clinical roadmap for today. We're covering 1. A global health crisis. 2. Beyond willpower, obesity science. 3. Hidden health risks. 4. Diagnosis and right goals. And finally, 5. Nutrition and mindset shift. Okay, let's dive right into this with part 1, a global health crisis. I want you to just take a second and think about your neighborhood. Now zoom out to your city and then expand that outward to the whole world. According to 2022 data from the World Health Organization cited right in these guidelines, there are a staggering 650 million obese adults globally. I mean, that is an astronomical number, right? The prevalence of obesity has literally doubled worldwide since the 1980s. This rapid increase has taken obesity from just a basic health concern and turned it into an alarming, full-blown public health problem. And just to show you how this global crisis hits close to home, let's take a look at this data from Turkey. So the TURDEP-1 study, which was conducted in the late 1990s, showed an obesity prevalence of 22.3%. But look at the TURDEP-2 study, conducted roughly 10 years later. That number jumped to 35%. That means more than 1 in 3 adults are dealing with this. The KEDD guideline explicitly states that this rapid surge frames obesity not just as a standard medical condition, but as a true pandemic. Moving right along to part 2, Beyond Willpower, Obesity Science. For so long, society has treated weight gain as a moral failing, right? Like it's just a lack of discipline. But the clinical science says something entirely different. Did you know that the familial transmission of obesity is actually between 40 to 70%? Genetics play a massive role here. To really understand how biologically complex this whole thing is, let's look at the literal tug-of-war happening inside your body every single day. Meet your hormones, ghrelin and leptin. Think of ghrelin as your body's hunger alarm. It's secreted right from your stomach, and it ramps up your appetite. When you finally eat, your ghrelin levels drop. On the flip side, we have leptin, the fullness thermostat. That one is secreted by your fat tissue. As fat mass increases, leptin levels usually go up, sending a strong signal to your brain to stop eating and start burning energy. In a perfect system, they balance each other out beautifully. But here is the crucial biological aha moment that should really relieve some of that guilt. As fat tissue increases, leptin increases, right? But eventually, the body develops what's called leptin resistance. This essentially means your brain practically becomes deaf to that "I'm full" signal, even though there is plenty of leptin circulating in your blood. When you combine this neuroendocrine imbalance with elevated ghrelin and insulin levels, you get a biological environment that strongly resists weight loss. It's not just about putting down the fork. It is a highly complex internal system that has gone off track. All right, let's look at part 3, hidden health risks. And this brilliantly illustrates exactly why we need to take this so seriously. Obesity acts as a chronic gateway to a whole host of other diseases. It isn't just about carrying extra weight. It's a systemic condition. It's the leading risk factor for obstructive sleep apnea. It literally doubles the risk of heart failure. It brings on painful conditions like osteoarthritis and gout. It's tied to really severe psychological impacts like depression and social isolation. And crucially, it is the second most common preventable cause of numerous cancers, including breast, colon, and pancreas. But if there's one single statistic from the guideline that really drives the severity home, it's definitely this one. The risk of developing diabetes is an unbelievable 100 times higher in women with a body mass index over 35 compared to those under 22.4. And for men, it's about 50 times higher. The extreme cardiovascular and metabolic toll of excess fat tissue simply cannot be overstated. That brings us to part 4, diagnosis and right goals. So how do doctors actually evaluate this? The most common starting point you're probably familiar with is BMI, or body mass index. It calculates your weight relative to your height. As you can see, a BMI of 30 or higher officially classifies as obese. But the guideline is very, very careful to note that BMI has its flaws. It can actually be pretty misleading. For example, a heavily muscled athlete might register as obese, while an elderly person who is losing muscle mass might register as healthy, despite having dangerously high levels of visceral fat. Now, what's really interesting about this slide is how modern medicine handles those BMI shortcomings. When doctors need more precise data, they turn to advanced tools like bioelectrical impedance, DEXA scans, or even MRIs to measure your exact fat distribution. However, the guideline stresses that one of the absolute best, cheapest, and most vital metrics you can track right at home is your simple waist circumference. Why? Because belly fat is the most direct indicator of cardiovascular and metabolic risk. So, what is the actual goal here? A lot of people fail because they think they need to immediately hit some perfect, healthy BMI. But the medical guideline emphasizes a much more realistic, life-saving target, the micro win. Dropping just 5 to 10% of your initial body weight within the first 3 to 6 months is a massive victory. That small percentage drastically improves diabetes control, lowers blood pressure, reduces the need for medications, and vastly improves sleep apnea and joint pain. You don't need to be perfect. You literally just need to start with 5%.
Let's move to the solution phase with Part 5, Nutrition and Mindset Shift.
How do we actually achieve that 5 to 10%? Well, the KED guideline makes it crystal clear that management requires a multidisciplinary approach. It's not just going on a diet, it is a fundamental shift in nutrition and psychology. Psychology is absolutely the foundation here. Cognitive behavioral therapy is heavily recommended. Step 1 is self-monitoring, writing down not just what you eat, but how you feel when you eat it. Step 2 is stimulus control, figuring out what triggers your overeating and changing your environment to prevent it. And step 3 is habit changing, doing things as simple as slowing down how fast you eat and focusing entirely on your meal without the distraction of your phone or the TV. When it comes to the food itself, the guidelines stress that one size does not fit all. Very low-calorie diets are strongly discouraged because they simply aren't sustainable for the long haul. Instead, evidence-based approaches are the way to go. The Mediterranean diet is fantastic for lowering your heart disease risk. The DASH diet is specifically designed to target hypertension. And intermittent fasting, which involves a 12-plus hour fasting window, is also recognized as an incredibly effective time-restricted strategy. The real trick is finding the one that you can actually stick to. No matter which dietary pattern you choose, the clinical recommendation for weight loss is creating a sensible daily deficit of about 500 to 1,000 calories. And your macro breakdown should look roughly like this: 45 to 50% of your energy from complex carbohydrates, 25 to 30% from healthy fats, making sure you balance those saturated and unsaturated fats, and 15 to 25% from protein, which is vital to maintain your muscle mass while you lose the weight. Wow, we have covered a ton of ground today, from the staggeringly high global numbers and the deep neuroendocrine biology of hormones like leptin, right down to the specific medical therapies and macro breakdowns. So I want to leave you with this final provocative thought, based entirely on the KEDD guidelines. Are we ready to view obesity not as a lack of willpower, but as a treatable chronic disease? When we finally drop the guilt and embrace the science, we empower ourselves to seek real, clinical, evidence-backed help. Thank you so much for joining this analysis today. Take this knowledge, apply those micro wins, and take control of your health.